Hello, are you the pharmacist?
Yes, hi, how are you? What's your name?
My name's Anna.
Hi, Anna. I'm Andre. Nice to meet you.
Nice to meet you. I need some help.
Okay, what's going on today?
I burnt my hand cooking cookies 2 days ago.
Okay.
And it doesn't seem like it's getting any better.
Okay. Have you done anything to help that at all?
I've just been putting ice on it.
Ice on it? And, do you know how long you've been doing that for?
About 3-4 times a day.
Okay.
The last 2 days.
You know how long you were doing it for?
Usually about 30 minutes.
30 minutes at a time?
Yeah.
Okay. Can I take a look at that?
Yeah.
Go ahead and peel that off.
I just used Band-Aids.
Oh, yeah, I see you got a few on there. Okay. And what was your age, you said?
I'm 68.
Okay. And is there any health conditions that I should know about?
I'm a type 2 diabetic.
Okay. Okay. How about we go ahead and explore some options for you going forward, okay?
Sounds good.
Okay.
Anna presented to the pharmacy with a blister that was still painful and not healed 2 days after injury. She decided to treat by applying ice at 30-minute intervals over the past 2 days. However, treating blister burns with ice or iced water is not recommended. This can increase the pain and depth of the burn, essentially impairing wound healing and prolonging pain. However, running the blister over room temperature, cool tap water, or using a cool compress for 10 to 30 minutes is beneficial for up to 3 hours after the injury. The first product listed here is the CVS Health Burn Relief Gel. It contains as an active ingredient lidocaine hydrochloride 0.5% and an inactive ingredient aloe barbadensis leaf extract, which is essentially aloe vera. A similar product, Burn Gel Max, contains lidocaine in a 4% formulation and also contains aloe vera as an inactive ingredient. The last product, the CVS Health Aloe Vera Cooling Burn Gel, contains just the aloe vera by itself. Although there is limited data, aloe is thought to have a soothing effect on the skin without providing a healing benefit. The lidocaine contained in 2 of these products is not recommended to treat pains from blisters. However, first-line treatment for this pain includes oral non-steroidal anti-inflammatories such as ibuprofen or naproxen, or an antipyretic such as acetaminophen to reduce the pain and inflammation from the burned blisters. The next product here, CVS Health 100% tea tree oil. The box indicates that this agent is used as a soothing agent for the skin. However, literature databases indicate limited data on the use of this and only as an antimicrobial against skin infections such as athlete's foot, acne, and methicillin-resistant Staphylococcus aureus, also known as MRSA. The next slide here contains generic ibuprofen 200 mg capsules. This next picture contains a generic version of acetaminophen 325 mg capsules. As mentioned earlier, these 2 agents are first line in the treatment of minor pain from blister burns. The next product here is the CVS Health Bacitracin, and the active ingredient contains bacitracin zinc 500 units, and as an inactive ingredient contains petrolatum or petroleum jelly. The next product here, Neosporin, is a triple antibiotic ointment. It contains bacitracin zinc 400 units, neomycin sulfate 3.5 milligrams, and polymyxin B sulfate 5,000 units. It also contains petroleum jelly as an inactive ingredient. Overall, most sources recommend against opening or popping blisters. It is suggested that blister formation is a natural barrier against infection, and opening the skin increases the risk of infection. Over-the-counter topical antibiotics, such as the 2 I listed before you, may be used on intact blisters, although it is not necessary since the risk of infection is low. However, certain populations, such as diabetics, elderly, immunocompromised, are more susceptible to infections. The next product here is the CVS Health Manuka Honey Gel, which is essentially 100% medical-grade honey. Limited data suggests that this may improve healing of burn wounds. The next product here, Aquaphor Healing Ointment, contains 41% petroleum jelly. To improve wound healing, it is suggested to create a moist environment for the wound by applying non-greasy skin protectant or moisturizers directly to the wound and covering it with non-adherent dressings. Petroleum jelly is essentially a skin protectant, which is what Aquaphor contains, although it is rather greasy compared to a Eucerin cream. Using non-adherent dressings, such as the CVS Health Sterile Gauze Pad, are preferred with these types of products. Another type of dressing is the NextCare Tegaderm waterproof dressing. This is a hydrocolloid dressing that is recommended if an open blister oozes exudate. However, there is insufficient evidence to support the use of one dressing over the other. Recommendations are based solely on a case-by-case scenario. Sources used for this information include UpToDate, Pharmacist Letter, and the American Academy of Dermatology.
Alright, to go ahead and treat this burn, first I'd recommend stopping the ice. So when you actually ice your wound, it's gonna make it longer for it to heal, and it also can increase the pain over time as well. And initially we do like a cool compressor, cold water running under it for like the first 3 hours after injury. But since we're already 2 days after that, I recommend we'll not do anything with the ice. And did you say there was minor pain as well associated with that?
Yeah.
Okay. And so for that, I recommend doing a over-the-counter, like a Tylenol or an ibuprofen, because that will help with the pain and help with like the inflammation as well. So either one of those would be fine. And I would personally recommend the ibuprofen because that will help you a little more with the pain and inflammation. You can take that every like 4 to 6 hours, just one 200 milligram tablet. And then as far as the wound goes, we're going to want to apply some topical Neosporin. So I have this here for you. And you can just go ahead and apply directly on the wound just a little bit so it covers it completely. And you'll want to do that, it says 1 to 3 times a day, but I would say just do it twice a day, 1 in the morning, 1 at night. So every time after you wipe the Neosporin off, you're going to want to go ahead and wash it with a mild soap and just like room temperature or cool water. And then once that dries, you can go ahead and apply it. And then on top of that, you're going to want to wrap it with some non-adherent gauze like this. So that will kind of go ahead and keep the wound moist, which will improve like the healing and pain overall. You don't want an environment that's like too wet or too dry. So using the Neosporin with the non-adherent dressing would work, because Neosporin contains this ingredient called petrolatum, and it's like petroleum jelly, the same thing that's in Aquaphor. So I'll go ahead and help the healing with your wound there. So yeah, just go ahead and keep doing that until the wound feels better. Do you have any questions at all about anything, or?
I don't think so. That makes a lot of sense.
Okay. Well, if you do, you can always give our pharmacy a call. Otherwise, yeah, that's it, okay?
All right, sounds good. Thank you, pharmacist.
Not a problem, okay?
Thanks.